Archana, I think I think Dr. Gupta is here, Dr. Rajiv Gupta. We can't see you, Dr. Gupta. Can you just make him co-host, Archana?
What should I do?
No, I'm sorry, just asking my colleague too. Archana, are you there?
Yes, sir, I'm making.
Just making co-host. Huh? Thanks.
So should I make co-host to DK Bharadwaji?
No, I don't think so. No. You can put him back in the waiting room. Dr. Gupta, your camera is off.
So there is video.
Yeah, we can't see it. Can you log in and log out again?
इतना टाइम है ना
Sir, you have asked Dave to screen share the presentation.
Well, I've sent it to both of you, you know. So,
I have asked him to be ready because in my
Okay.
presentation.
okay. Dave is here.
Hello.
Yeah, can you hear us?
Yeah.
We'll make you just co-host. Yeah, we made you co-host. Can you
Okay.
just your camera is still off, doctor.
My camera is कौन सा होता है?
Zoom है क्या नहीं video is on
Yeah, but we can't see you. You know, here's my suggestion to you. Are you
Yeah.
connected from a laptop?
Yes, I have a laptop with me.
Okay, so next to the video button,
Yeah.
Now- next to the video button, there'll be an arrow.
Yes.
Yeah.
चलो
If you click onto the
हाँ
arrow,
अभी आया था ना
नहीं आया है. If you
Auto
click onto
frame my
the-
video.
Yeah, just go to video settings.
video settings नीचे
Yeah.
Now, is there a camera over there? Camera is setting.
Yeah.
Camera
it is
selected.
blocked
Camera selected. नहीं. Oh. Camera selected is Doctor. There's no camera coming over there.
Look,
copy
there is a camera is there. There is a cross across it.
Okay.
Share screen should I put?
नहीं
share screen नहीं.
पहले तो कैमरा आना
उसके नीचे do you see anything? Not seeing any video, then HD video.
HD. So there are HD original ratio mirror my video preview.
तो HD video को वो कर दीजिए, टिक कर दीजिए, you know.
को हम भी नहीं दिख रहे ना आपको
कर दिया.
नीचे करो
Not seeing any video. वो क्या कहता है फिर? Make sure that your webcam is plugged in and turned on.
Oh, that you must be on from a laptop, right?
Check the video selection above to use the correct webcam.
Okay, here's my thing to you. You know, why don't you connect from a phone?
Okay.
We'll do the presentation. You connect from a phone because or what you can do is you can switch off the laptop and switch it on again.
हाँ करके देखो
चलो वो करके देखते हैं.
Otherwise, you can connect from a phone or an
लीव
iPad,
मीटिंग
whatever.
करो ना, लीव मीटिंग.
अर्चना अर्चना
हाँ देव.
are you playing the video?
Video, I'm trying that only. First
Okay.
time.
Just check, otherwise I will check from here.
Okay.
Rehana, are you there?
Yes, sir.
How many people do we give credits for in questions in senior
20.
health webinar every week?
20 credits, sir.
Huh?
20 credits we give.
No, but how many people are there?
It depends, sir. They ask 3-4 questions, but for one only we are giving 20 credits.
Yeah, but I'm saying how many people do you give credits to?
Let me check, sir. Sometimes it is 23. Sometimes it is 13. It depends, sir.
It depends on who's asking questions.
Yeah.
Only people who ask questions.
Yeah, sir. Only those who ask the questions now we are giving credits.
Okay.
Video was visible, no? देव.
क्या
वीडियो था विजिबल, अभी मैंने जस्ट शेयर किया था.
वीडियो आया लेकिन साउंड नहीं था उसका.
Archana, can you make him co-host, Dr. Gupta?
Yeah.
No, same problem. What do you think he can do, Archana?
Sir, he'll have to give the permission from his mobile phone if he's joining from the mobile. I think he has not given the permission to Zoom app from his mobile.
No, he's from a laptop, not connected from a laptop.
Through laptop.
Just
Maybe there is some technical issue in his laptop. Because this happens with senior SAP talent people also. So we asked him to
I
change
think
the
he has
laptop.
not given permission for the camera for a Zoom
Yeah.
app.
Dr. Gupta, are you there? Dr.
Same
Gupta?
like mobile.
Okay.
Yeah, so we can't see you, Dr. Gupta.
लिंक तो मुझे व्हाट्सएप पे है क्या? लिंक व्हाट्सएप से नहीं मेल में. लिंक का ना और प्रेजेंटेशन.
Presentation we'll make. Presentation, don't worry about, we'll make it.
तो मेरे तो मेरे व्हाट्सएप पे भिजवा मेरे मेल से भेजती हूँ.
I'm just sending you the link on WhatsApp.
Okay.
On your WhatsApp, Dr. Gupta. When he joins from WhatsApp, Archana, you may have to rename him. Huh? I don't know what name will be there.
Okay.
भेज दिया
ओ
तुम्हें.
मुझे कह रहे हैं.
We are going to share the cover page also.
Yeah. At the beginning itself, after I introduce him.
fresh देना तो fresh दे दे नहीं तो और सारा मत निकाल के रखना एक एक निकालते जा रहा है आगे
Just ask her to give me tea, na?
they can't see you.
Yeah, you can't see me.
No, we can't see you. We can't see you.
तूने भेजा मुझे
हम्म
दो क्यों भेजे हैं Zoom पे?
गलती से भेज दिया था वो।
अच्छा हाँ चलो पहले तो ये खोल के देख लेते हैं अगर इससे हो रहा है तो फिर तुम मुझे प्रेजेंटेशन भेज दो
If you're connecting from a laptop, Alka Gupta. Okay. Um,
I'll take Dr. Alka's laptop.
yeah, you can connect. You can disconnect this one.
Yeah, now you can see. Na?
Yes, I can see. Thank you.
Now you can see me.
Yeah.
राजीव वो बंद करो नहीं तो इनको send me the presentation.
वो आप लॉग आउट कर लीजिए उस दूसरे मशीन से. हाँ. Archana, can you just rename?
Yes, sir.
Yeah. No, A with an A.
Okay.
Yeah, and just add a doctor before that. Yeah, thanks.
Excuse me, I'm logging out, Pradhiman.
No, not this one. Don't log out this one.
No, because I'm going to download the presentation on this laptop.
So don't log out. Don't log out. Just be there.
How do I make the screen small?
On the left hand side, there'll be 3 buttons there.
बीच वाला नहीं काम कर रहा या तो वो
राइट वाला ग्रीन वाला देखिए ग्रीन वाला आप करने से छोटा हो जाएगा.
हो गया एक मिनट राजीव मेरे कुछ फंस गया अब क्या हुआ ये लॉग आउट मेल पे भेजा है ना? ये भी हाँ मिल गया, डाउनलोड हुआ है, बस को यहाँ लाना होगा ना। क्या नाम क्या है? नाम क्या है?
एडिटर से आया होगा
हाँ
नाम
नहीं, प्रेजेंटेशन का नाम क्या है?
पॉलीफार्मेसी
कहाँ है देखो, पीपीएफ नहीं,
It is medication _ overload _ presentation _ doctor _ Rajiva Gupta. Rajiva _ Gupta.
टुडे इज 22 नवंबर। राजीव देखो जरा, मिस तो नहीं हो रहा इसमें मेरा? एक मिनट इधर आओ, उसको तो वैसे भी हटा दो ना।
Shall I send it to you, ma'am? What is your email
नहीं
address?
नहीं, आई हैव जस्ट डाउनलोडेड इट,
Okay, great. Okay.
आई नीड टू जस्ट पुट इट ऑन माय डेस्कटॉप।
Okay.
एक मिनट,
नहीं इतना नीचे क्यों जाते जा रहे हैं?
ये ना उसमें है,
सर्च में नहीं
सर्च नहीं है, मुझे नहीं आता। कहाँ है देखो जरा।
नहीं ईमेल में नहीं है, ईमेल राजीव गुप्ता देख लो।
ईमेल से तो मैंने ले लिया ना इधर, ईमेल से डायरेक्ट कैसे लूंगी? मेरे डाउनलोड्स में है, अभी डाउनलोड किया मैंने।
सर्च नहीं डाउनलोड
नहीं,
रिसेंट
नहीं ना यार, यहाँ आता है ना डाउनलोड पे, मैं जो करती हूँ अभी आया होना चाहिए, बिकॉज मैंने अभी डाउनलोड किया। एक मिनट जरा, एक मिनट देखो, ये मेल खोलो, ये रहा ना, अब ये डाउनलोडेड है, ये रहा, मेडिकेशन ओवरलोड ना।
That's right. That's right. Medication overload.
वेट आई, ठीक है, ये तो हो गया, यहाँ तो है, डाउनलोडेड है। नाउ व्हेन आई open my downloads, it should be here na, it should be in my downloads.
वो अल्फाबेटिकल है।
अल्फाबेटिकल है ना, एम में होना चाहिए, ये रहा मेडिकेशन पीपीटी। ओके, कॉपी, ठीक है, एंड पेस्ट। कहाँ है?
If there's a slightest issue, don't worry. We have the presentation. We can also run it.
What happened to the meeting? Am I out of it?
आप चिंता मत कीजिए, आप let us do the presentation. Dr.
ठीक है।
Gupta, you
Yeah,
sit.
ये रहा, I got
okay.
it, I got it.
Because what you'll also have to do is you'll have to start the screen share to test it out, and then
हाँ,
again opt out of it and again do it once again.
where is my screen gone now? ये रहा, हाँ ठीक है, एक मिनट। सो ये रहा राजीव, मेडिकेशन ओवरलोड। ओके, सो यू हैव मेड मी एन admin.
Co-host, yes.
Hmm?
We made you co-host so you can do a screen share.
Yeah. So share. It's that green button. I've never done
That's
a
right. That's right.
desktop, entire screen. Share.
The thing is that you'll have to do it once again, because when we start out, we do not want the screen to be shared. It's only later on. So don't do it just now. You can do it later on.
No, but I'm not able to do it, and I don't even know now where have you guys gone here. I'm not able to do it. Allow Zoom workplace to share your screen, open system settings. Audio recording only Zoom.
Don't worry. Don't worry.
This will not happen because
Yeah, we'll do the presentation. We'll do the presentation. Dave, you have the presentation, right?
okay.
Yeah, it's open.
Yeah. So we have it. Don't worry. Let him.
Now, where is the screen gone?
Oh, we can see you.
We can't see you.
Okay.
Okay,
Just go
yeah.
to on the
Yeah,
right hand side. Can you?
Ranane, we got it. We got it.
Okay. All right. Cool.
मैं तुम्हें वो दे दूं? एक मिनट. Now are you okay?
नहीं तो whatever is supposed to do, deny open system settings.
नहीं, don't worry. अभी वो सब छोड़ दीजिए.
Deny that. Yes, ठीक है. अच्छा.
Okay. Great.
Fine.
Yeah,
Is
fine.
he okay?
Thank you. Thank you.
You want me to put the
Light.
the charger?
नहीं तो देर से लगा दें.
So I'm starting the video.
Yeah, we are starting right now.
One second. I'm just putting the charger here.
Yeah, start.
क्या हुआ?
नहीं हो गया. टक के हुआ. टूट गया वो. हैं?
चलो ठीक है, नहीं हो गया. ठीक है. अरे थोड़ा सा पीछे तो बैठो, तुम्हारा तो कट तो नहीं है.
Hello and welcome to Health Live at Seniors Today. We are delighted to have you all again with us. And today, a session that we are conducting is by Dr. Rajiv Gupta. If you remember, Dr. Gupta has been on our sessions in the past, and the November issue of Seniors Today magazine. Can I just request our producer to show the magazine? So this is the cover of the magazine, and which says "Too many pills, too little health." And we invited Dr. Gupta to talk about polypharmacy, a topic that he has discussed in the past as well, and to examine how multiple medications can make aging less safe. So here's Dr. Gupta. But before I invite him to speak, let me introduce him. Dr. Gupta is with the CK Birla Hospital at Gurugram and also consults at his clinic, which is the Upchar Wellness, also in Gurugram. He's a specialist in internal medicine and diabetes with an experience spanning over 4 decades. He did his MBBS from the Maulana Azad Medical College in New Delhi and an MD from Dr. Ram Manohar Lohia Hospital, also in New Delhi. He has done a postgraduate program in diabetology from the Johns Hopkins University of Medicine in the US and a specialist certificate course from the International School of Diabetes. As I mentioned, he's practicing in Gurgaon, which is Gurugram, and he's conducted, several continuing medical education programs, and he's written a few books, which we've also spoken about in the past. And we welcome you again, Dr. Gupta, to Health Live at Seniors Today. How are you?
I am good, and thank you, Pradyuman, for the nice words. It has always been a pleasure, and I look forward to be with this August group, whether it is through my writings in the Seniors magazine or presentations, and sharing my insights and whatever information is available at this point
Absolutely.
of
And I
time.
think this topic of polypharmacy is something that, it is very important, and especially for seniors who are going to multiple doctors. And there's, of course, a tendency to pop a pill, just because one has had it in the past and without any real, clinical examination. So to all of you here, Dr. Gupta is going to be making a presentation, but do note that this is being recorded. So, you don't have to take notes just now. You can watch the recording when it's up on the site on Monday evening. And do remember that this is being recorded. This is being aired live on November 22nd, 2025. So in case you're watching it 2 years later, do check for updates in medical technology, in medical developments, etc. Also, do remember that this session, the advice given here is advisory in nature. So in case you do have a serious issue, you should consult a recognized medical practitioner. Over to you, Dr. Gupta. I'm going to request my colleague to share the presentation once you're ready.
Good evening, everyone. Today we'll discuss a growing but often overlooked issue, polypharmacy, which is defined as taking more than or equal to 5 medicines concurrently. In seniors, the issue of polypharmacy has got profound repercussions. The objective today is to give insights into how polypharmacy starts, why it becomes dangerous, and what steps we can take, both as clinicians and patients, to prevent medication overload and its consequences. Let me begin with the typical scenario which we see in daily practice. So this is the reality of modern aging and why today's subject matters. The patient, Mr. VK, 79 years old, he is a retired bank manager, very active, has hypertension, chronic kidney disease, peripheral neuropathy, anxiety, and occasional insomnia. He is currently on 7 medications: ramipril, amlodipine for high blood pressure, pregabalin for neuropathy, and alprazolam half tablet for insomnia, plus a multivitamin and a calcium supplement. When he gets up and he looks at the pile of medicines, he sighs and wonders, which one is really helping me? Can so many medicines harm me? So whether we are able to answer this question or not, we'll see as the presentation follows. But the bigger picture is that with increasing longevity, chronic illnesses are rising. And managing multiple illnesses often leads to multiple medications. Polypharmacy has become extremely common in elderly people. In what starts as a well-intentioned, well-meaning treatment chart gradually turn into a medication overload, and with this potential to cause harm as well. Polypharmacy is called the hidden peril of modern medicine. And let's see the data. So more than 5 medicines is now routine for many older individuals, and India, 1 in 3 seniors lives with polypharmacy. The burden is still higher in our urban settings. 57% of seniors take more than 5 medications, and more than 20% take even more than 10 medications. And to add on to that, 38% are taking over-the-counter drugs, and 63% are taking herbal or alternative remedies. In post-hospitalization phase, there is the surge of medicines, and if we see the discharge summaries of our patients, we find that they may be on as many as 14 medicines. And not only that, this usage of medicines or polypharmacy has got a profound impact. It contributes to 1/3 of all hospital admissions. And this fact is often unrecognized, as we'll see subsequently. And the risk multiplies with every pill. Studies show that with 2 medications, the risk of adverse health outcomes such as falls and hospitalization is around 13%, which rises to 58% with 5 medications and 82% when the number of medicines increase beyond 7. Now, what causes polypharmacy? After all, what is driving polypharmacy? So there are systems driving factors or patient-driven causes or factors. So the most important is multimorbidity. Multimorbidity is defined as having 2 or more medical conditions, and each illness adds a treatment. Then there are multiple caregivers, siloed prescribing duplication interactions. Because the multiple caregivers, each one will not coordinate with the other or see the notes of the others. He will write his own medicines, and the already medicines have been written by another specialist. Then there is a phenomenon called prescribing cascades, treating side effects as new diseases. So that is one thing. Or secondly, somebody has a side effect because of a medication. To curb that side effect, another medication is given. So this is a cascading effect. Then there is symptom overload. Many medicines are given for symptomatic relief, for example, for pain, for sleeplessness, for anxiety. More the symptoms, more the drugs. Then there are many medicines which earn the reputation of having preventive benefits. So people say that I have to take a medicine for acidity, and which are called the PPI, the proton pump inhibitors like pantoprazole or rabiprazole or omeprazole, antiplatelet agents for blood thinning in an attempt to prevent stroke or heart disease, heart attacks, vitamins added just in case, let's take, there is no harm, it gives strength and so forth. Then the patient-driven causes, expectations and requests. So many people, when they come to us and they say, when I see their prescription, aspirin is written, but why are you taking aspirin? No, we have been told, and our another friend is taking aspirin because it keeps the blood thin and prevention of strokes and heart attacks. Or there may be some online suggestion. This is the day of social media, and influencers are there, and each one gives his inputs. And many of the times, those inputs are taken very seriously and acted upon. Then there are over-the-counter supplements, vitamins, herbal pills. They're added without disclosure, and which are, because they are deemed to be harmless, but we don't know that they may still be causing side effects or interactions. Self-medication, as I said earlier, of antacids, painkiller, sleeping aids, they also keep on contributing silently to the load of the medications. Why is polypharmacy risky, and why are the seniors especially vulnerable? So it is not that the medicines are bad, but it is the changing body's chemistry. The brain becomes more sensitive, and therefore the doses which are safe in a younger population, they cause side effects, especially the ones which act on the brain. There may be dizziness, confusion, or falls. Kidneys slow down because kidney is the natural filter of the body, and the drugs stay longer because the filtration becomes less. The drugs stay longer inside the blood, and the chances of toxicity of those medicines increases. Many of the drugs are metabolized in the liver. the liver function also declines. And medicines, for example, the sedatives and painkillers, their levels rise in the blood. Then there is more fat and less muscle. So fat-soluble drugs accumulate. And a typical example of a fat-soluble drug is vitamin D. In fact, we had seen an elderly lady, 90 plus. I visited her home, and I found that she was a little talking incoherent and drowsy. And we found that she was on multiple, different forms of vitamin D. And we checked her calcium, because the purpose of vitamin D is to increase the calcium levels. Calcium levels were in the toxic range. We had to admit her here in Gurgaon in Vedanta Hospital. Then the treatment for hypercalcemia was given, and she improved in about 48 hours. Let's see how polypharmacy affects the physical health and the everyday life. So there is a higher incidence of falls, balance, mobility, appetite, energy, and sleep, bowel and bladder effects, and blood sugar fluctuations. Polypharmacy increases the risk of falls, fractures, dizziness, and hospitalization. The drugs are called fall risk increasing drugs, especially the sedatives, the sleeping pills, certain blood pressure lowering medicines, and are the similar FRIDs. They significantly increase the fall risk. And the consequence is that the person becomes, once having a fall, they become short in confidence, in movement, and because of the fear of falling, and then they stop going out and keep on restricting their activity. There is an effect on appetite, energy, and sleep, a feeling of persistent tiredness, low appetite, morning fog, especially with sedatives which impair alertness, and stimulants which cause late night insomnia. So overall, there is a reduced stamina for daily activities, and there is a cycle: drowsiness, fatigue, mental fog, and this goes on. Some of the medicines, they are called anticholinergic drugs. For example, some which are used in treating cognitive impairment or treating prostatic enlargement. They may cause constipation, urinary retention, or incomplete emptying, often caused by anticholinergics, pain medicines, and some antidepressants as well. A special mention about people who have diabetes. Excessive diabetes medications, they may cause dangerous hypoglycemia if the medicines and the blood sugar values are not corroborated. The person may manifest as having sweating, tremors, sudden dizziness, confusion. So in such cases, the goal is not a perfect or a very tight glucose control, but it should be safe and consistent control. There is a profound impact on the quality of life, cognitive, emotional, and safety. So polypharmacy affects memory, mood, and thinking. As we had mentioned earlier, confusion, forgetfulness, slowed thinking, irritability, low mood, reduced alertness. Some medicines block neurotransmitters inside the brain. The reflexes become slow, and the reaction times become reduced. So overall, there's a vicious cycle. So impairment of memory, then thinking and irritability. So they all cause a vicious cycle. Then there is a psychological and emotional stress. So you see, more the number of medicines, more unwell the person perceives to be about himself. Then there is an anxiety from complex medication schedules. Kitne baje lena hai, morning, evening, after breakfast, before meals, after meals, frequency. So this becomes very overwhelming, and it leads to mental fatigue from constantly remembering dosages. In fact, it becomes very distressful. Medicine start feeling like a burden rather than a support, because they have always, your mind is preoccupied with this medicine has to be taken before and after. And that's why when people come to us and they ask me, doctor, can we reduce the medicines? I take it very, it has to be taken very empathetically, because that's a very genuine concern. Then it affects the daily life, independence, and autonomy. So the people become reduced in confidence in managing self-care. There is a fear of missing doses or taking the wrong pill, and increased dependence on the family with loss of independence, which is again a very distressful situation. There are safety and healthcare risks, high risk of adverse drug events like falls, dizziness, confusion, drug interactions and medication errors, more side effects, drug-induced symptoms masking illness, delayed diagnosis. Now, if there is a drug-induced illness and the symptoms are taken as a new illness, so the healthcare team would be after those illnesses rather than even considering whether that could be because of the drug, and the diagnosis becomes delayed because already we have spent good amount of time. Then there are more clinic visits, more investigations, and obviously resultant higher healthcare costs. A very important thing about medicine's interaction and the risky combinations. So somebody is on a blood thinner plus a painkiller can trigger serious bleeding. For example, diclofenac and aspirin. So this can trigger GI bleeding. Many people are on antidepressant medication or a cardiac medication. They may cause irregular heartbeat, palpitations, and even sometimes serious arrhythmias. Sleep pill plus an anxiety pill can lead to dangerous drowsiness and falls. So whenever we are managing our seniors, there are certain red flags to watch for and which have to be emphasized to our senior patients. Any new confusion or any new unusual sleepiness. Remember, it is new because, as I will mention in my subsequent slide, any new symptom after starting a medication should be considered deemed to be because of that medication. Frequent dizziness or falls, apart from the major illnesses which are concerning, with the brain or in other systems, drugs could also be a culprit. Dry mouth, constipation, or trouble passing urine, loss of appetite or increasing tiredness, easy bruising, or unusual bleeding. So there is a dictum in seniors, any new symptom is drug related until proven otherwise. If you remember this, then the chances of uncovering or finding the precise cause of deterioration in somebody's health as an acute deterioration will always be much higher. So let's see the same, the case scenario which we had started our talk with. Case scenario 1, when normal doses become dangerous in seniors. So Mr. VK's question was, can so many medicines harm me? So let's see. One day he develops a viral respiratory infection, seemingly benign because it is so common. And he started taking an OTC cough syrup twice daily, which I think most of people would do. But within 48 hours, he was extremely sleepy, slowed breathing, confusion, could not stand without support, and the family brought him to the emergency room, where he was admitted in the ICU. Monitoring was done, the offending drug was stopped and improved in about 48 hours. The root cause was a combination of pregabalin. Pregabalin is a drug which is given for neuropathy, but which has got effects on the brain as well, plus alprazolam or Alprex, which all of us know. So these were the two medicines which he was already taking. And the cough syrup most of the cough syrups have a good amount of antihistaminic or anti-allergic components. So these in combination led to dangerous CNS, central nervous system, and respiratory depression. And on top of that, it was worsened by reduced kidney clearance. So the outcome was admitted with altered sensorium and respiratory depression, required monitoring and drug withdrawal, recovered after 48 hours. All sedatives reviewed and represcribed. Represcribed means that they were removed. And the family was educated about the dangers of over-the-counter prescriptions without the knowledge of the drug. So there are few lessons which can be drawn from this case. The drug-disease interaction, chronic kidney disease, and renally cleared drugs. So person is on multiple medications, the clearance of those drugs becomes impaired. OTC cough or flu medicines can be very dangerous in seniors because of the kidney disease, because of the sensitivity of the nervous system, and because of their own intrinsic sedative effects. Sedative combinations, all of them, three, in fact, alprazolam, pregabalin, and the antihistaminic in the cough syrup, they led to respiratory depression. So there is an importance of adjustments because of the kidney disease and importance of medication review during illnesses. Next case, when multiple specialists don't talk to each other. Now we can, in a lighter vein, that the medicines don't talk to each other, obviously, but they do talk within when they are inside the body. But the specialists don't talk to each other. Mrs. R.S., 78 years old, retired school principal, socially active. She has a history of hypertension, osteoarthritis, acid reflux, anxiety, and she has been seen by different specialists, which it is a common scenario. And each specialist added medications without reviewing the existing ones. No one checked the interactions or necessity of all prescriptions. She was having 9 medications in total, 2 different antihypertensive drugs, and incidentally or unfortunately from the 2 different doctors but belonging to the same class. For example, if I can mention, so there is a antihypertensive which all of us know is telmisartan or telma, and another one is olmesartan, olmesest or olmi. Both of them belong to the same class. But if 2 different people see, for example, if a internal medicine doctor is seeing a patient as well as a cardiologist is seeing, both of them may be writing their own favorite medicine, but the patient doesn't recognize it and the doctor is also not seen, and they are subject to duplicate medication. 2 pain medications from the orthopedic doctor, diclofenac, which is, we all know, Voveron, tramadol, which we identify as Ultracet, a proton pump inhibitor for acidity, anti-anxiety and sedative at night, plus calcium plus vitamin D supplements. So the outcome was that she became excessively sedated and unsteady. She had a fall at home, suffered a hip fracture, hospitalization. Why? Because the sedative plus tramadol plus duplicate BP drugs caused a drastically lowered BP, which caused her to be dizzy, confused, and increased her fall risk. So this case shows that the lack of coordination between specialists, duplicate medicine classes, sedatives plus analgesic increase the fall risk, and preventable hospitalization due to polypharmacy. The third case, when painkiller interactions turned dangerous, 75 years old male DS, he has heart failure, chronic obstructive pulmonary disease, and mild cognitive impairment. He is on furosemide or Lasix, metoprolol or Metolar, salbutamol inhaler, donepezil for cognitive impairment. The first 2 medicines are for heart problems. Salbutamol is for COPD, donepezil for cognitive impairment, aspirin for heart, ibuprofen as needed for joint pain. He experienced severe gastrointestinal bleeding and was rushed to the hospital. The combination aspirin and ibuprofen has led to the bleeding. The kidney function has worsened due to multiple medications that are metabolized through the kidneys, increasing the bleeding risk. And as such, a person who has a kidney impairment also has a tendency of increased bleeding, even merely by the presence of a kidney disease. However, it also looks very negative that polypharmacy is very bad, it's a big villain, but it's not always bad. So the better terminology would be whether it is an appropriate polypharmacy or an inappropriate polypharmacy. Now, appropriate polypharmacy is the one which is necessary, which is evidence-based, which contributes to well-being, for example, managing diabetes, hypertension, and heart disease together. So obviously, there will be anti-diabetic medication, there will be medicines for hypertension, for heart disease, and the number of medicines likely to be higher. But this would be called appropriate polypharmacy. However, in even these circumstances, it is imperative to regularly review the medicines and see if any untoward happening is there. Then there is inappropriate polypharmacy, which is unnecessary, duplicative, harmful, or unreviewed. It often results from continuing old prescriptions by default or adding new drugs without considering interactions. As Pradyuman had said in his introduction, that polypharmacy, they have found the medicines to be useful earlier, so they keep on taking those medicines. So the key to prevent is a periodic reappraisal. At every OPD visit, we should check the ongoing need and dosage. At hospital discharge, reconcile hospital and home prescriptions, because most of the time, again, we find that when the patient is discharged from the hospital and the medicine which he has been taking at home, they are very much different, because the discharge summary mentions the medicines based on the condition of the patient in the hospital. And whenever a new symptom appears, consider whether it could be drug related. Another solution is Deprescribing. Deprescribing means a careful withdrawal of the drugs. It is not neglect. It's a careful supervised subtraction for better health. How do we do it? Review all the medicines, including the over-the-counter drugs, vitamins, and herbal supplements. Identify what's no longer needed or potentially harmful. Like today, I saw a patient in my OPD. She had been taking the medicine for 15 years. Then I asked her attendant, her daughter-in-law, कुछ फायदा हुआ है? नहीं, फायदा तो हुआ नहीं, लेते जा रहे हैं. Then I told them to visit the neurologist and ask, is it really beneficial to worsen? Gradually reducing or stopping such medicine under medical supervision. And scientific studies have shown that with this deprescription, almost 40% of medicines can be reduced. There are 30 to 60% fewer inappropriate medications. Not only that, a 30%, 36% lower hospitalization risk and a 26% lower death risk. So better alertness, mobility, and adherence to essential drugs. So what are the practical steps for patients and their families? Carry all the medicines, tablets, syrups, inhalers, vitamins, herbal items, etc. to one doctor for review. So after my article, people read in my friend circle, they read the article in the Seniors magazine. So they asked me, pointing out to this fact, to one doctor for review. Doctor, who is that one doctor? Then I told them that you have to have a family physician or a person from internal medicine who can coordinate everything, guide you about the right things, and in case it is necessary, to communicate with your specialist. Maintain a current medicine list and mark discontinued ones clearly. So many times, as we said earlier, that the medicines, they are being just taken continuously and not removed just for the heck of it. They are being taken, so they are continued. So whichever ones are not have not been advised or not been reviewed, they should not be taken. Use pill boxes or smartphone reminders for adherence. So pill boxes, we all know. Smartphone reminders lately, they have been in the market. So they're connected with the YouTube through the Bluetooth, and there are reminders set in through some softwares, etc. Never stop certain medicines abruptly, for example, beta blockers, steroids, or antidepressants. Ask the doctor, do I still need this medicine? Could a lower dose work? Are there safer alternatives? So one has to be proactive. After the doctor is examined, then these questions should be raised and very explicitly, clearly put forward to the doctor. Another method which we find and which is often overlooked is it necessary to take so many medicines? Cannot lifestyle be a substitute for few of the medicines? Yes, of course. Exercise daily about 20 to 30 minutes, depending on your physical capacities. That helps in lowering blood pressure, lowering blood sugars, lowering cholesterol, improves mood. Eat a balanced diet rich in fruits, vegetables, proteins, and fibers. Maintain a good sleep hygiene. Stay hydrated and connected socially, because all these will decrease the chances of dizziness, falls, improve the stamina, the endurance. These will help in this way. And one thing I mentioned was social connections. I forgot to mention. So if you are socially connected with like-minded groups, that also helps in de-stressing and probably decrease the reliance on antidepressant medication or anti-anxiety medications. So looking into the future for smarter and safer prescribing, pharmacogenomics, where the situation will come where medicine can be tailored according to the genes. Electronic health records will help each doctor to share the prescription and see at one go what medicines the person is taking. Telemedicine and remote monitoring encourages timely reviews and dose changes without physical visit to the doctor. Smart pills and boxes and a lot of apps are there which can help in reminders, adherence to the medicines, and fewer errors. Artificial intelligence data integration. So that is an upcoming branch and the buzzword today, that detects drug interactions early, avoids duplication. Then there are patient portals which empower seniors to track and understand their medicines. However, technology enhances safety, but human judgment remains the cornerstone, and there is no substitute for that. The best scenario is when medicine and technology plus insight of the doctor, that always leads to better outcomes, and when they come together. So self-check is important. Ask yourself, am I taking 5 or more medicines daily? Has my doctor reviewed them in the last 6 months? Am I using OTC or herbal remedies? Have I been feeling dizzy, drowsy, or tired lately? If yes, it's a time for medication review. It might be the most important health checkup for all of you this year. So takeaways would be that polypharmacy is a hidden epidemic today based on the data which I presented earlier. Regular review reduces risk. This prescribing leads to safe care. It is not a neglect. Less can mean more and a better quality of life. Every medicine should have a purpose and be reviewed regularly. My closing thought is that polypharmacy is not just about numbers, it's about balance. When every medicine has a clear role and every prescription is reviewed, we reclaim our health, independence, and peace of mind. And less can sometimes mean more. The goal is not a long prescription, but a long, healthy, happy, and a safe life. Thank you.
Thank you very much. Thank you very much, Dr. Gupta, for an amazing presentation. And to all of you over here, do look at this copy of the magazine. You can see on the Seniors Today website, seniorstoday.in. The article is also on the website, and of course, the video will be there live. A recorded video will be there on Monday evening. Dr. Gupta, we have a question over here. Is it all right to take Ayurvedic medicines along with allopathic? Ayurvedic and homeopathic medicines along with allopathic.
See, I deliberately avoided the use of word Ayurvedic because probably I'm not in a position to make any comment upon the benefits or the harms. But then, as far as the allopathic system of medicine is concerned, we know the ingredients of the medicine. We also know, because they've been tried in laboratories and before release or before launching into the market, they've been tried, and all the red flags and safety warnings, etc. They are made known to the public. The same thing is probably not available to us about the Ayurvedic and the homeopathic medicines. I'll give you a very simple, like we must have all heard of now these weight reducing drugs, Monjaro, Wegovy, and Ozempic. So they are very helpful in reducing weight and they are doing wonders. And one of the companies has hit a 1 trillion something market capitalization or something like that. However, when we start, so if I have to prescribe this medicine, I suggest them, but then I tell them, you go on the website or you go on the net, search it, or I give a write-up from my side. Yes, these are the possible side effects. Certain side effects are there which may be very, very infrequent, 1 in 10,000 or 1 in 100,000. Like today, somebody was sharing on a WhatsApp group that one of the medicines they have to give it in Denmark, 80,000 kroners or something as a compensation. So therefore, they know. Now, if you start a medication, we have to warn the person, yes, this is a possibility. You choose, unless it is mandatory or life-saving, that's a different matter. So about the allopathic medicine, these facts are aware. We are aware of them, but it will be difficult for me to say about Ayurvedic medicines.
Right. And what about, you mentioned about social media and, various things that are being suggested over there. So there are these gut health supplements that are there and a variety of things. And many of them say that they're clinically tested. How safe are they to have along with your regular medication?
See, so gut health medicines, basically they are probiotics so they are available as a part of allopathic medicines also. But to be used as a preventive health, probably they're not justified, because if you take a healthy diet in terms of a lot of fiber and high quality proteins and complex carbohydrates, low fats, healthy fats, so the health would be taken care of. Now, just for the sake of, because it's a very ill-defined, yes, gut health, there are certain studies, but whether those ingredients or those products which actually they are improving the gut health or not, nobody knows. I will give you cite one example. For example, probiotics. So, in many gut-related disorders like irritable bowel syndrome and things like that. So, they have been given and they have been seen and they have shown a minimal benefit. So, there it is justified. But as the routine taking something probably is not.
Right. Thank you. We have a question from Sunita Verma, who asks, can BP medicines and uric acid medicines be taken together?
Yes, they can be taken together, but it is seen that there are very few medicines. Most of the blood pressure medications also increase the uric acid levels. So just as a doctor, from a doctor's point of view, so there is a medicine called losartan. Perhaps that is the only antihypertensive agent which does not increase uric acid.
Right. Thank you. We have a question from Parveen Kumar, who asks, should one to take a medicine half an hour medicine before a meal, is that beneficial?
So it all depends. Now, see, for example, the typical medicine which we all are aware of, thyroid medication that has to be taken about 1 to 1.5 hours prior to a meal. Similarly, medicines for osteoporosis, which are called bisphosphonates or osteophos, again, they have to be taken empty stomach. Sugar medicines are also sugar medicine, insulin, they also have to be taken prior to meals. But certain medications cause gastric intolerance. So, for example, metformin, that would be taken after meals. So it all depends upon the individual drug, and I think we have always seen the doctors always tell as to when it should be taken.
Right.
Obviously, the absorption of medicine is better when taken on an empty stomach, but then we have to see the side effects also.
We have a question from Ms. Shobha. She is from Delhi and leading numerologist. She is asking a question. Doctor, I'm taking blood thinner, Apiband 2.5 for the last 3 months. Sorry, is it safe? Along with the Dilzim CD90.
See, now she is taking perhaps for a arrhythmia, probably. She has not written the medical condition. So apixaban is a anticoagulant, blood thinner. Diltiazem, what she is mentioning, is given for controlling the heart rhythm. So people who have got arrhythmias, they are more prone to develop embolization, what is called the blood clots go and they will lodge into the brain or somewhere. So yes, that is the standard of care. I mean, there's no harm in that. She should take that under medical supervision.
Right. We have a question from Bomi, who's asking about a husband who's 80 years old. She asks, is it safe to take Kremafin syrup if my husband moves his bowels every 3 days?
I think it would be safer to use what is called a suppository. Suppository is a small tablet which is inserted in the rectum, and then there is a movement, and then it helps in evacuation. However, we also have to identify, yes, constipation is a side effect, is a pressing problem. We have to try to find out what could be the cause of constipation. Is it because of immobility? Is it because of multiple medications? Or something can be addressed in the diet as well as hydration. I think all these factors, if they are taken care of, probably his dependence upon Kremafin become less. But otherwise, there is another entity called laxative abuse. So the body has become so much used to the laxative effect of Kremafin that the response to the urge to defecation wouldn't be there.
Right. Doctor, we've done with most of the questions. I'm going to take 5 minutes of yours now. Which, according to you, is the number one most abused drug? Would you say paracetamol or Dolo or?
No, paracetamol would not be called an abused drug because paracetamol has got a very high margin of safety, and the side effects are only if it is taken in a very high doses. In fact, what would you call it? The poisoning type of thing. So, and the dose of paracetamol is in healthy adults is about maximum 4 grams per day. Dolo 650 is paracetamol 650 milligram multiplied by 6, so maximum 650. is the safest dose. However, we don't find that people require that much. Most of the time, they do not require. So I think, in my observations, and as we said saw in the presentation also, these sedatives and the painkillers, they are the most abused drugs. Probably, I think pain is a more common problem. So NSAIDs, especially people who have got osteoarthritis of the knees, rather than going for a physiotherapy or exercise or yoga, or if the doctor considers knee replacement as a mandatory, people keep on taking these anti-inflammatory drugs, and they cause harms. Steroids are another misused drugs, but probably the number would not be that much. But still, if somebody has got asthma and if he finds relief with steroids, go on taking, or somebody has got a skin problem and you're responding to the steroids. So most probably, I think the painkillers followed by sedatives. Neend nahi aati hai. Because once you start taking Alprax or something, they're addicting drugs. You will not be able to get off those drugs. Probably painkillers and sedatives would be the most abused drugs.
Doctor, let's take a hypothetical situation. We are entering the winters. It's very cold in some parts of the city, in some parts of the country, including in Mumbai, where it's getting nippier than normal. And if one does develop a cold or whatever, what is a recommendation you have that one should take if one has a cold?
See, now, so there are, one is cold, primarily it's got two reasons. One is an allergy or maybe pollution related. And second is a viral infection, which is like a flu type of infection. So allergy, people, they may just take an anti-allergic drug. They are aware of that, and maybe take for 2 or 3 days. And if they don't find relief, then they should consult a doctor. So there is a thing called a rule of three. 3 days you try medicine. Otherwise, if you are safe, you're okay. Your vital parameters are okay. You can try those medicine for 3 days and go ahead. So symptomatic relief, for if you are having headache, you can take a paracetamol. For anti-allergic, something like a loratadine or a cetirizine, maybe taken for 2 or 3 days. But at the same time, seeing that what other drugs the person is taking, that is also important. And if there is a flu-like a viral infection as such, then the paracetamol, hydration, and monitoring of vitals, wait for about 2 or 3 days, and if otherwise you're okay, then most of the flu, and they will settle down within about 3 to 5 days. If it doesn't settle, consult the doctor.
And what about a cough syrup?
The cough syrups in controlled doses, maybe 1 teaspoon twice daily, but again, you have to see what other medicines you are taking. It all depends. So, see, we have to identify the vulnerable age groups. What is the vulnerable age group? It is not just the age. Somebody is 65 or 70, it is not necessarily. It all depends upon the morbidities which he or she is having, what other illnesses she is having, what other medication the person is on, what is her medical condition, kidney condition, and neurological condition, all these things. So it has to be individualized.
Great, doctor. Thank you very much. We've got a few more questions, but I think they are mostly repetitions and they are addressed by your presentation. Thank you once again, Dr. Gupta, for being here, for being here, over and over again. You've written 2 cover stories for us, once on fatigue and the other on polypharmacy. So thank you very much for being around for us. And to all of you here, if you do have any questions related to this issue, you can, of course, look at the magazine. You can watch the video when it's up on the website on Monday evening. You can do that, and keep reading Seniors Today, and check out our various content on Evergreen Club, as well as on our daily website that is updated Monday through Saturday. Thank you once again, Dr. Gupta, for being here, and we will be back again next Saturday at 5 p.m. and we're looking at doing a session on skincare for the winters. So do log in at that time. And thank you once again. Thank you.
Thank you, Prathiman. It has been great.
Thank you.